First session is Applied Global Health Diplomacy, and it's about the global health diplomacy and its application to not just government professionals, representatives of NGOs, but also the general public, communities, and engaging in public health for action.
Global health diplomacy is just the manner of influencing foreign policy in the best interests of health. So in foreign policy, through diplomatic processes, often health is not a core component of what people are trying to accomplish in war, conflict, etc. So we're just trying to insert health and make it more important than anything else.
Global health diplomacy simply is improving health between nations while also improving the relations between nations. Recently, we've seen it play out in the Ebola outbreak. The response to Ebola necessitated many nations coming together to respond to this acute public health emergency. We've actually done some research to show how global health diplomacy is really more of a pyramid. At the very top is the core, government actors, multi-stakeholder at the middle level, institutional actors, and then informal health diplomacy, and that's the general public, people who are engaged with a public health problem and trying to solve that solution within their community.
The one thing that communities can do to influence policy, and specifically influence diplomatic processes, is becoming active advocates for public health. So we talk about Generation Public Health here at APHA. That's one way you influence the policy process, and through that influence, you also influence things that happen on the international stage. And that's through changing the lens of how diplomatic negotiations work and making sure that health is a critical component in all those negotiations.
Global health diplomacy is not really relegated to the embassies or the diplomats. It really needs to come from the bottom as well. And all of these actors need to happen concurrently to have global health action.